22 veterans take their own lives every day in the United States. It's a harrowing statistic illustrating the toll that service can take.
But there is help available via the Veteran Suicide Prevention and Crisis Line. A recent overhaul has made that hotline more accessible than ever before.
News 8's Duncan McLean reports.
Since 2007, a nationwide network of specifically trained crisis intervention specialists have answered more than 8.5 million phone calls, 1 million text messages, and 420,000 online chats from veterans in need of assistance. In 82% of those cases, the veterans that reached out said that their interaction with the hotline played a role in preventing them from making an attempt on their own life.
Veterans Crisis Line services matter. We know that after connecting a veteran to services after their initial contact with the Veterans Crisis Line, it saves lives.
Michael Noble serves as the acting director for the Veteran Crisis Line for the National VA, and despite positive statistics, recognized a years-long flaw in the hotline's accessibility.
We don't want there to be any barriers. And if having to remember a longer digit telephone number could potentially create delay or even dissuade someone from reaching out, let's remove that.
In 2022, on the heels of the first increase in veteran suicide rate since 2018, the Veteran Line joined the National Crisis and Suicide Prevention Hotline, adding a veteran extension at 9881, while also bolstering staffing and accessibility for text and online chat interventions. Those changes motivating even more positive statistics.
We know that since the implementation of 988, we've seen a 22.7% increase in daily call volume.
On top of the increased call volume, a 45% growth in text messages and an 8% growth in online chats.
We want to be sure that by any means available, a veteran can reach us in a time of distress.
Those calls are answered around the country by crisis intervention specialists specifically trained in military culture, who will make assessments for suicidal, homicidal, mental health, and substance abuse risk, alongside providing emotional support and concrete resource referral. They can even dispatch emergency services if needed. The final key, though, there is no minimum crisis level. None of those risk factors must be present to call for help.
There is no threshold. If a veteran is feeling distressed, in crisis, if they just need someone to talk to, we know that loneliness, helplessness, hopelessness, mental health support, relationship challenges, substance use and addiction, those are all some of the things that our crisis responders field when they're answering these calls, but it doesn't necessarily have to fit into those categories. If it's a question, if you are questioning whether you should reach out, reach out.
To talk on the phone, just dial 9881. To chat online, visit the website veteranscrisisline.net. And to text, send a message to 838-255. The line is open 24/7, 365 to veterans and their friends and family. Don't hesitate. Make the call that has already saved countless lives.
Our Veterans Day coverage will continue tonight with our Veterans Voices special. You can catch that right here on Wood TV starting at 7. In Grand Rapids, Duncan McLean, News 8.